Hi, my name is Hans-Horst Konkolewski, and in the name of the Global Vision Zero Business Council and the International ORP Foundation, I would like to welcome you to the third and last edition of our series of webinars devoted to Vision Zero in times of COVID-19. Our main focus today will be on 4 critical success factors for a safe return to work for the millions of people that have been affected by lockdowns during the peak of the pandemic. Each topic will be presented and discussed at a roundtable with 3 OSH managers from renowned Vision Zero companies. And we'd like you to join. It's easy. Just use the Q&A function at the bottom of the screen and send us your question or comment. Our first roundtable is addressing the most important overall precondition for a safe and healthy return to work, namely the need to nurture and preserve an emerging caring prevention culture. Please welcome Josep Maria Verijo, OSH Director at Suez, Philippe Delbecq, Safety, Health and Environment Manager at L'Oréal, and Franco Duto, a Senior Vice President and Director of HR Compliance and Sustainability at Tsubaki Nakashima. Josep, please introduce the topic to us.
Okay, thank you, Hans. I want to thank you for give me the opportunity to share the experience of Suez in this coronavirus pandemic and what we learned and what we can be shared with all of you. I'm going to share my screen. And okay, well, as I mentioned, only a few words to introduce Suez in Spain. I am sure that you know our global company present in the 5 continents and with 90,000 people around the world. In Spain, we supply water to 1 of each 4 people in the country, 25% of market share. And we are a staff of 11,100 professionals doing our work. We have a long experience in Spain, more than 150 years of experience, and we have several brands in each of our autonomous communities and our regions in Spain. Only to fix a little bit what kind of company we are, and what we like to present to you is our experience and our what we have learned with this coronavirus crisis management related to some attitudes and some behaviors that I think that could be perfectly related with the objectives of Vision Zero that Hans-Horst mentioned as the initial part of the webinar. Then, well, the first topic I want to share with you is the anticipation. I think that it was a success to anticipate, and we did it on the 26th of February when the focus was absolutely put in China. 7,000-8,000 cases there, and Iran and Korea was the focus of the pandemic. Only 400 cases in Italy, no deaths, and only 13 cases in Spain. And well, in Spain, the most of the people was talking about if it has been a good decision to cancel the Mobile World Congress or not. Obviously, if you look the situation from now, it was a perfect decision, of course. Then we start anticipating many measures. I don't want you to read all of that, but only to show you that we will react very soon. And after some days, we was closing our technical and administrative offices and our customer service attention offices too, and we adapt all of our operation. The second thing I want to share with you is the agility. I think that all of we in our companies have shown an extremely agility in these times, in these time management times, because we was managing the company in a completely different way, with a lot of new committees, all of them crisis committees, and a lot of coordination between all of them, real-time coordination, daily meetings, and on the other part, to be able to communicate what all with what we were doing to the employees in a confident way, no? And at the same time, to have the relation with the trade unions that allow us to manage in a good environment, and with their comprehension and their help. Well, health has been the king in this crisis management. Then the protection. It has been another important thing for all of us. We was able to put in teleworking all of our staff from technical offices, and at the same time we did the same with the people working on customer services offices, and we continue managing the relationship with customers, but by virtual channels, and probably it will be the start of a new approximation to how to manage the relationship with customers in many utilities. At operational teams, of course, we have we are a water company. We are an essential service, and then we continued operating all the infrastructure on the plants, all the wastewater treatment plants and tap water treatment plants, and all of our networks on the field, of course. And then we have to adapt a completely operation. And the protection from biological risk is not something special for us. We know perfectly this kind of protection of our employees, and then it was not a special topic for us, because we know perfectly what we have to do to protect from biological risk. And another thing we did was to identify all sensitive people, and all of them, and we put them at home or teleworking. If they was not possible for them to telework, they was at home and safe from the coronavirus. And a couple of initiatives that we could start with all of that was these two. We launched a biosecurity unit in order to ensure that all the disinfections we are doing in all of our installations and facilities and plants was perfectly done, and with the maximum guarantees. We have a network of laboratories, and then this kind of things could be done due to our experience. And at the same time, we launched a psycho-emotional unit and conducted by a clinical psychologist, in order to support all the people who was in teleworking, and most of that, all the people we have had confined in the main infrastructures, like wastewater treatment plants, and living there. I am going to talk a little bit more on that in next slides. Well, at the same time, we have to protect the service, of course. The service was the water is essential for healthy service for the complete population, for the industry. Then we have a special operation plan to manage all of our infrastructure in a different way, but in the same degree of security and being able to ensure the quality and the quantity of the water for everybody. Well, another interesting thing, I think that we not only in Suez but in many companies we have shown in this crisis is the absolute commitment of the people. As I mentioned, we put we confine in plants. We confine in the wastewater treatment plants and tap water treatment plants some people that ensures that they will be safe there. They stay at the plants 7 or 14 days without leaving the plant and living in this motorhome as you see in the photo. And all of these people were volunteers, and then we have to thank well the commitment of all the people in this kind of situations that could well ensure that our service continues perfectly. We have several degrees on all of that confinement, but well, I'm not going to come into these topics. Another thing that we have learned, I think that we share that with all of you, is digitization. The internet or the information technologies and communication technologies has played an essential role, and I think that it could be a new start of all of these topics too. Well, at the same time, the responsibility. We are using tests from the beginning for the people who need to be confined in plants, and to ensure that for him and for her, their work shift, that when they enter in the confinement, they was absolutely clean and not infected, and we use PCR tests to do that. And nowadays we are doing a general campaign of antibody test for all of the employees in the company in order to have an idea of our immunity at a global level. Well, related to restarting, well, I think that the word is caution, absolute caution. We are following 3 main moments on all of that. The first moment was when the non-essential economic activity was allowed. In Spain, it was at April 13, and we shift this moment to our company to April 20th in order to be sure that the things are done with prudence and with caution. The second point in Spain was on May 11th, in which the government starts the disconfining phases. Well, we are going to start the activity on our sites 14 days before the different regions gets the first phase of this confinement of the government, and the third phase will be, we think that could be maybe at the fourth quarter of the year, not now, and it will be when when the people could go to the restaurants or leisure in a normal way, or when the schools will open again, all of that. And in this moment, we permit to return the sensitive collective, and we are going to permit another time access to our installations or other kind of things.
2 minutes. 2 minutes left.
2 minutes. Okay, only one. Hans, thank you. And to summarize, I think that there is a word that combines all of that, and these are awarenesses. awareness from part of for managers, from employees, and I think that from society and families, and all of that. Well, it has been an absolute lever. Only to share with you that our work injuries has been decreased by 45% if we compare these actual 4 months respect the last ones. Well, I think that health awareness has led to safety awareness. This is an essential message, I think, that from Vision 02, and our mission is to preserve all of that in our new caring prevention culture. Well, this is all from me. I thank you all your attention. I am ready to your questions, if any, or when Hans disposes.
Well, thank you very much, Josep, for this excellent presentation, for sharing your experiences, and no less than 9 values, key values for your prevention culture. So now I turn to Philippe. We have just learned about these 9 values for managing the pandemic at Suez, and which forms the basis for what Josep called this new caring prevention culture. Do you recognize some of these values, and please share with us the principles that L'Oréal's prevention culture is based on, and if the pandemic, like in Suez, at Suez, has influenced that?
Yeah, thank you, Hans. Thank you for giving me the opportunity of bringing a few comments on what José María had been saying. I'm going to share with you my screen. Hold on a second. Okay. Okay, this is, I hope you see my screen. Can you?
No.
No? Oh, hold on a second.
Yeah, no, it's fine.
Okay, yeah, I see quite a lot of common points with the Suez approach of the COVID-19. In fact, we have been thinking right from the start to how are we going to manage the crisis, and how will we be dealing with the new era after the COVID-19, just when the crisis was starting. In fact, this is a scheme that I had already been presenting some while ago, showing all the different chapters that we've been dealing with respect to the handling of the crisis. And currently, when we speak about the after COVID-19, now we are mainly struggling with a couple of instructions, couple of chapters that are here on this screen. The main one is, of course, people and environment. I mean, we know that we have quite a lot of influence on the environment, especially when traveling. And of course, you can imagine that traveling has been brought down to 0. And now we're going to really have a change in policy in the future with respect to the way people are behaving, the way people are meeting, the way people are moving in this environment in order to minimize the carbon footprint and, of course, minimize the interaction with people. So social distancing is also another very big part of the equation. Some other big parts are related to the vigilance that we will have with all that is related to the safety measures. We have been working quite a lot with protective masks, gloves, and all that is PPE related. And I think that there is a before COVID-19 era and an after COVID-19 era, to the extent that for a very long time, we had been dealing with a minimum amount of masks being available locally. And all of a sudden, we have realized that we were short in masks. So this is something that's a lesson that we have learned very well. We've taken all the arrangements that were necessary to get everything now on board. But that's something that we shall take into consideration for the future. Apart from that, there are also some other no-brainers, like the basic rules. I mean, basic hygiene rules. These are really things that are going to be applied once and for all. We did not need necessarily the COVID-19, but COVID-19 has really pointed out that we definitely needed to put that very well under control. There is also a big thinking process just ongoing right now with respect to the hardware. I mean, we see that in terms of protection, in terms of HVAC, we also need to have a more thorough look at the way we're dealing with all that is ventilation related, so that we make sure that people are really protected at the workplace. And this is basically what we are trying to implement. And when you consider the size of the company and the geographical spread that we have, this means that we need to anticipate right now this caring prevention culture, because this is going to happen over the coming years and we have no time to lose. Thank you.
Well, thank you very much, Philippe, for sharing your insights. And as you said, there were quite some similarities with different words, but it was very much approaching the same thing. And thank you for pointing out also that we are actually now in the after COVID-19 phase in terms of thinking in prevention culture. And I look forward to hear what Franco has to say in terms of if he agrees with the viewpoints that have been expressed as regards this new emerging caring culture. And in particular, I would be interested in learning on how do we actually make sure that we preserve this, this increased attention to prevention, to the importance of the individual behavior, social distancing, PPEs, and so on. So Franco, please share with us your experience. No, you have to activate your...
Okay. Now it should work. Right?
Yes.
Perfect. So I believe that we are still in a learning curve, no? Learning that the world is different, that global means global, in the good and in the bad, and in this case is in the bad. We are learning to observe, to look around with humility on what is happening in the other countries in order to, let me use a word that my colleagues already used, to anticipate the problems and to analyze the problems, to analyze the possible impact on our companies, to predict, the ability to react, to plan, to better define the roles, the responsibilities. I believe that another aspect of the learning curve, of the things that we are learning now, is the fact that we need to analyze much more the data. We need to understand much more the data, the information, to read the information that are coming every day, that are changing every day. In the last 2 or 3 months, we learned that we don't know. We don't know what is going on. We don't know how to deal with the unusual things. Especially, I'm talking about a company which is working in the manufacturing fields. So not used to have an approach on the biological risks, for example, because we don't have any risk. We didn't have any risk like that. So in reality, we are learning that the magic recipe does not exist. And we are really looking at the different countries where the protocols, for example, a curious thing that I would like to say is the fact that I have a bunch of protocols coming from all the countries where we are present. No one is equal to another one. No one is the same. So they have different approaches, different tools, different measures, etc., etc. And the risk to have a global protocol as a company is the risk to be too much conservative in some cases, but also to be not in compliance with the law, the local laws in other cases. So, I mean, another thing that is very connected to the caring prevention culture, as you said before, is the fact that if we take a look on the dynamics of the fatalities that are directly connected with the other or previous illnesses or sickness in the people who died, obviously we see that the hypertension, the heart diseases, the diabetes are very important. So I mean, as a company, we can influence the good behavior of the people. We can influence the way that they eat, the way that they make activities, the way that they use to live our normal life. I mean, because I am part of the company. So I mean, and I believe that the most important part in this phase is to continue to observe, take actions that my colleagues already mentioned, because more or less we are doing always the same, and also imagining another work environment. And I'm not only talking about the workplace or the working conditions, but really the approach that we use to work. My colleague before talked about the new shifts, no? The commitment of the people, the availability of the people. But I believe also that the new labor relation, we will have new labor relationship with the unions, with the representative of the workers, with the workers themselves, etc. Different layouts, different work shift models, etc. So this is a great opportunity, in my opinion, to face this disaster, because this is an economical disaster, in a way where we can born again, let me say.
Well, thank you very much also to you, Franco. And I have a couple of questions that we have received, which I would like to present. And I would like to start with Josep Maria. And the question is, in your experience, how they found rest of virus in the water? No? What kind of studies or practice make at water despite this? I think it's a question simply, have you found this virus in the water? Is there any link between the water supply or services and the risk of the virus? I think this is a general question of interest. And this is Guillermo Lagareta who was asked.
Okay, thank you for the question, because it's important to say that it has been identified rests of genetic material of the virus in the water, but this is not at all infective. Not at all infective, and in a proportions that is absolutely irrelevant. Then we are this kind of virus is not a very strong virus, and in the sewer waters, in the used waters, it's very difficult for him to live. And then only parts of genetic material has been found, and for sure, when these materials come to the tap water treatment plant or wastewater treatment plant, it absolutely disappears. What is interesting on that is that we could sample some point of the sewer system, and if we find some genetic material, we could advise previously to the next or to the maybe future outbreak of the virus locally. And this is what we are investigating and doing our works on that, but nothing to do with water, but only to help to prevent future outbreaks.
Thank you very much for this clarification. I think it's highly appreciated. I have also a question for Philippe, and there's a question related to PPEs, which you mentioned. No? And the question is, what are the best PPEs for administrative workers? And so I wonder, do you use PPEs for administrative workers, or how do you try to reduce infection risks there? Could you have to activate your microphone? Yes.
In fact, at the workplace, we use both social distancing by reorganizing the workplace so that people keep their distance from one another. And apart from that, we also distribute surgical masks to all administrative people. This applies not only at workplace, but also when they're getting back home, they can have at least their surgical mask to get back home and to come in the morning in the public transportation, for instance, which is one of the major concerns for people. So that's the way we have been dealing with the protection of people so far. We are not providing them with some face shields or some other features like FFP2 masks that we have heard of for medical personnel, for instance, but mainly surgical masks.
Yeah, thank you very much.
And of course, we also provide people with gel, hydroalcoholic gel, since we're making quite a lot of them. So we also distribute that to our people.
Thank you for this explanation. And we learned from your earlier presentation now that L'Oréal actually takes a very, very strong position as regards supporting this type of materials to not only to your own staff and families, but also to society. So it's really highly appreciated. Question, maybe I go, this is the last one, I go to Franco, because talking about this new prevention culture and the new normal, how do you see the link there? You said we are still in a development on a learning curve, but do you think that this new prevention culture, caring prevention, will be part of the new normal? And this was Andrea Moran.
Yes, absolutely. Let me make you an example because it's very curious. 1 week ago, I had an interview for a position in India. We were looking for the business development manager for the Indian region, etc., etc. So normally I conduct very strange interviews as an HR, I mean. And I asked him, what do you think that will be the legacy after this period for your country? And he told me, the discipline. That's a great point, in my opinion, because I believe that we are learning to be disciplined in our life, disciplined in the relationship with the others, disciplined also in the processes that we are following. So if this will be the new normal, it's very welcomed. Another thing that we are learning is other kind of additional competencies for the people, better defining the roles and the responsibilities, better defining the methodologies that we are following, not only in case of emergencies, but also in the case of the normal life, because in any case, it will be different. This event will impact our way to manage the companies, more or less, but it will be different.
Well, thank you very much. And thank you, because we are at the end of the first roundtable. We'll say goodbye to Jose Maria because you have to continue your activities in your company. So thank you very much for joining us. It's really a pleasure for us, also especially from the Global Vision Zero Business Council. We very welcome your participation today. So thank you very much.
Thank you, Hans. The pleasure is mine, and thank you for your comprehension, and bye.
Bye. Philippe and Franco will be later on in the program as well. So with this, I would like to go to the second roundtable. And the second topic relates to those group of employees that require special protection against infection risks and other risks. And this can be the older colleagues or those with pre-existing medical conditions or pregnant. And at the same time, critical to prevent the spread of the virus in the company from employees with infection symptoms. So this is a kind of double challenge in terms of protecting the vulnerable. So I'm very pleased to introduce our second panel. And the second panel is Jose Manuel Balinote, who is a health and safety manager at Acciona. Elena Kompasenko, I hope, I can't see you yet, Elena, but I hope that you will also open your video and will be part of this. And Philippe Delbecq. So this is the roundtable. So let's see whether we can get the cameras all right. And to introduce this topic, we have Jose Manuel. So I suggest you start, and then I hope we will get Elena live with us a bit later. So please, Jose Manuel, you have the floor.
Okay. Thank you, Hans. And well, first of all, as last time, I would like to thank you, Vision Zero and ORP Foundation to invite us to share our experience. Okay, it's always good to be part of these webinars, because as part of share, you always get a lot of good information to improve the management of the COVID, where everyone is learning at the same time. I'm going to share my screen. You can see the presentation?
Yes.
Yes, okay. So I would like just to start with a brief introduction of Acciona, of my company. Following of course, taking into account that we want to speak about the vulnerable groups, it's good to start with the definition, no? Who is considered as vulnerable in this pandemic, to finally check how we can manage, no? Once we have under control these employees, how we can manage, how these people can start to work again without any issue and any risk regarding the COVID. Regarding Acciona, well, we consider us as a sustainable company. Okay, we develop sustainable infrastructure solutions and as well as renewable energy project with more than almost 40,000 employees all over the world in 40 countries. And part of the health and safety department of the infrastructure division, where we have different businesses as construction, industrial, water, service, and concession. So sometimes in this kind of pandemic, no, that is first of all worldwide and that affect everyone at the same level. As you can imagine, it's difficult to manage when we have different business, no, because every business needs to have different protocols in place to be sure that the service, for example, sometimes need to be running even in the worst condition that we had not now, fortunately, but a few weeks ago. And well, starting with the presentation on the topic that we were set, I would like to share with you what is considered as vulnerable groups in Spain. Although this is the official list submitted by the Spanish Health Department, the rest of countries are using almost the same. Sometimes there are countries where they remove some of these illness from the list, or others that they are more specific and they have a longer list. But basically, we are speaking about cardiovascular disease, chronic lung diseases, diabetes, cancer at the active treatment phase, immunodeficiency, pregnancy, and employees over 60 years of age. Okay, and as the previous roundtable we're making reference when they speak about vulnerable, it is clear why we consider this as vulnerable, no? And the data that we receive is changing every day and sometimes every hour. Okay, but it shows that in these groups the mortality rate is higher, and even much higher when pathologies are combined. For example, people over 60 with chronic lung disease or cardiovascular. No, that we can say is the three where with the higher mortality rate. And even when people who is part of these groups, we can say survive the illness, the after effects are longer and more serious, even sometimes permanent. So we are saying that even when people is not dead, the consequences are still serious. So that makes you aware that we need to do something special with all the employees who are part of these groups. I'm just making reference to the over 60 years old. No, I think the data included in this presentation that you can see that speaks by itself. For example, just in Spain, over 90% of the deaths are in that group, in people over 60 years old. And as you can see, the rest of countries is kind of the same, more in Europe where the population is older than other continents. So it's clearly a group that we need to take into account, and we need to do our best to be sure that they are not exposed to the illness, at least during the work time, no? Because we cannot control the life. Well, I would like to share the experience that we have in action in this case to how to manage these employees, and starting with this process. No, we start with a process of information in the first phase. Second phase, identification of these employees, evaluation once they are identified, and once we have the information of the evaluation, adapt the work position if necessary. No, and I will explain quickly because I know I have 10 minutes if I'm not wrong, Hans. So I will
yes,
try to,
exactly.
I will try to
Thank
be
you.
in that time. Information, well, you know, every company has their own communication channels, so it's always good to put all this kind of information there. No, for example, in Asuna we have our internal web where we post all the information about vulnerable. We are in the digital era where we have access to more information than ever, but that's the reason that sometimes we don't focus in the important ones. So we need to be sure that the information is shared in proper levels and that everyone knows who is vulnerable. No. Once we pass that phase, we need to start in the identification. Identification starts more with a direct email, okay? Because even posting the information in the normal communication channels cannot be enough. So a direct email needs to be sent. But the email needs to be sent with, we can say, a correct approach. And I mean correct approach, taking into account that, first of all, we are asking for a very sensitive information that employees may not want to share with us, okay? So it is something that we need to take into account. So we need to use an approach in a way that we need to be sure that we want to help them, okay? It's not like we are going to tell them, okay, you tell me that you are vulnerable, or if not this. No, it's like, tell me that you are vulnerable because we are here to help you and to adapt your work position to be sure that you will not get the illness while you are working. No? And in this phase, of course, we need to filter all the information that we receive because, as you can imagine, we receive the information of vulnerable employees, but also a lot of stories, no? People that sometimes is just scared and they want to have more information, or maybe people that even not being vulnerable, they have a family member at home who is vulnerable, no? That at the end, it could be considered basically the same. Once we have identified the employees, is when the phase 3 starts, that is the medical evaluation. Sorry for the Spanish in this matrix, but it's the official one that was submitted by the Spanish Health Department, where basically you need to use 2 factors: the exposition levels to the illness, I mean, like how exposed this person is in their work position, and then also the pathology situation, no? How controlled that pathology is in regarding the situation where we are right now. On the information is evaluated and the medical service have the evaluation ready, then is where the health and safety department can again, no? We have finally the evaluation, a part of all the measures that maybe the medical service in this case put it or include in the report. We have defined the vulnerability level, okay, where this is going from 1 till 4. In the level 1, no affection or change of position is required. Means that employees are vulnerable, but they can perform their activity with no issue. When we speak about level 2 and 3, is when we need to start the adaptation. I mean, the employees can still work in the same work position, but with limitations in this case, or at least, or with the use of PPE. And then level 4 is when change is required of the work position. And if not possible, then the sick leave needs to be processed until the spreading level of the illness will be reduced. No, this is the situation that we are now in Spain, no, where the illness is starting to be under control. As you can imagine, when employees are in the levels 3 and 4, the easiest thing to do is continue with the working from home. No? But of course, if your workplace is an office, no, as I said at the beginning, as you know, we have different business where people is not in an office, no, so they cannot really work from home. In that case, when employees are out of office, specific, and when I mean specific is individual specific, not just in a workplace, not like every person should have their own organizational and individual measures, okay? As for example, continuous active monitoring, that means that it's not enough for example, the temperature and symptoms control that we are doing in our access control. It to be at least on a weekly basis. That person needs to report how things are going, if he or she feels that is exposed to the risk when it's not supposed to. And when I say weekly, it's at least weekly, okay? If it is possible to do it daily, it will be even better, no? Not by the safety department, the manager of that employee. Also, regarding the planning, vulnerable employees shall not be assigned to a task that might involve close contact, okay, social distance. Of course, that is a general rule, but as you can imagine, for example, in construction, there are activities where we cannot comply with the social distance, no? So we need to use PPE, we need to use sometimes other or change the procedure that we usually use to perform the activity. But with vulnerable employees, we need to avoid that. I mean, this is where the limitation starts. That employee can keep working in a construction site, but if need to be part of an activity with more than one person and not respecting the distance, then that person cannot perform that activity in particular. And then, in case in the workplace or in the activity of the vulnerable employee, the mask is mandatory, non-surgical mask for these employees. I know that most of the associations and around the world are keeping or saying that the protection mask, in this case FFP2 and the FFP3, are for the medical service, and it's true. But so here we are speaking also to vulnerable employees. That means that they need to be protected. As you know, with the surgical mask, what you have is at the end a collective protection. I mean, if everyone wears the surgical mask, of course, everyone is protected because you protect the others when you use this kind of mask. But we cannot risk with vulnerable employees. So again, in case they need to have masks for their tasks, need to be or FFP2 or FFP3. And that's all. I hope it was 10 minutes. Sorry if it was a little bit more.
No, thank you very much, Jose Manuel. It was perfect, right to the point, and I think very practical. Once again, you have at Acciona really developed very practical hands-on tools and approaches to a rather complex reality, because in your business, you have many different groups and many different functions to take care of. It's a very complex activity you do. So thank you very much. And I wonder now if we have a phone connection to Elena Kompasenko, who would be the next to speak, or if we give, let us see, is Elena available? Elena? If not, then I suggest we jump to Philippe, and then hope we can establish the connection to Elena after that. So Philippe, once again, welcome, and thank you for joining also this roundtable. And so we would be interested to learn what measures you have taken at L'Oréal to protect the most vulnerable groups during the pandemic, and if these are similar experiences, so it's a French, Spanish, international kind of parallel, or if you have taken different measures.
You should see common, quite a lot of common points between the approach of Jose Manuel and the one we have at L'Oréal. So let me share my screen once again, please.
Yeah.
Here we go. This is it. This is once again the description of the different chapters that we have been dealing with during the management of the crisis, and this part of the screen is really dedicated to people at work, so work organization. And of course, when speaking about work organization, we used to speak about a lot of events, a lot of seminars, a lot of things that we used to deal with. Everything, of course, has been totally reshaped with respect to all employees, and more particularly the vulnerable employees. This also applies to the retail and sales, because we also have quite a lot of employees there, and we also had to make a kind of screening of people that were vulnerable compared to those that were not vulnerable. So in fact, I think that everything has been dealt with case by case. It has been a big kind of struggle between all the different parties involved, simply because in some cases we may have some occupational MDs involved, and in some other places we don't have medical doctors, we don't have occupational medical doctors. So we needed to find some other ways. And HR, of course, was at the center of the whole system, together with the boss, the N+1 of each employee. So it has been really a big discussion in order to find the right way to treat people. So I'm not going to go into detail enough in terms of the different diseases that were involved, but one thing for sure, there was a very early precaution taken with respect to keeping people at home as soon as possible, as soon as we had some rumors. And in my neighborhood, for instance, I had a couple of warnings at the beginning of February, and we were already confined at home by mid-February, when the rest of the country was confined by mid-March. So this is to say that we have been taken into account very, very quickly. In fact, the other point that I want to make is that all the returns have been dealt with case by case. I mean, as soon as you are known by a company for having one or another disease, then you can be sure that your case is going to be dealt step by step, and you shall be recommended to stay at home as long as possible. As some people have returned on May 11, some others are planned to return in June, some others may be planned to return only in September, depending on what they have, and this is of course dealt with by the medical doctor. Another thing that is very, very important also is how are we going to decipher all the very weak signals in people. For instance, we know that at this moment, about half of the population, not only L'Oréal, but the general population, half of the population is feeling depressed because of the COVID-19, because that's a situation that no one had experienced so far. So we know that there's some people may be in distress, and we need to decipher all those weak signals, not only the medical signals about the evolution of the disease in people, but also the psycho-emotional effect of the COVID-19, how it's going to affect people at work, not only at work on site, but also at work at home. And of course, another very, very big hurdle is to apply all that I've said globally. As I was saying before, we are spread over 150 countries with different labor codes, different traditions, different medical systems, different everything. So if we want to apply those rules globally in order to be fair to everybody, it's a real nightmare, and it's a real big organization for HR to make sure that everybody is taken into account according to their own situation. So as Franco was saying before, we have to be very, very humble. We don't know what Christmas will look like. We don't even know what September will look like. So we learn every day, and we need to adapt, because nothing is set in stone for the time being. That's what I can say. For the time being, these are the arrangements that have been taken for the most vulnerable people. And we don't know whether we would have to reinforce them in the future. Only COVID will be saying in a few months, in the coming months.
Okay. Well, thank you very much indeed, Philippe, for sharing L'Oréal's experiences and concepts, now, which again also very well structured and considered. And I have already a few questions for you. So, but before that, we try again to connect with Elena Kompasenko. Elena will join us by phone because there's some video connection problems, but we have a nice photo of Elena, so so we will place it there. So as you can see, so Elena, from the point of view of Zarubezhnev, now how do you manage vulnerable groups in your organization? And then you have to think about that you have your operations, your production facilities, your transmission facilities, sometimes very remote, and sometimes also under very harsh, let's say, weather conditions. So we are interested to hear how you at Zarubezhnev are addressing this issue. Elena? Elena? Oh, it seems that we still have problems with the connection to Elena. I hope we'll be able to solve them. Yep. Yes.
Yeah, well, Hans Horst, this is Irina
Yes.
Karpova.
Okay, Irina.
Very unfortunate that Elena cannot join right now, but I can speak on her behalf. Hopefully for the next roundtable, the technical issues will be solved and she will be able to talk. But right now I can tell you what Zarubezhneft is doing in order to protect the most vulnerable employees and what measures they provide.
Perfect. Thank you very much.
Yeah, so first of all, I would like to say that Zarubezhneft started to talk about and think about the COVID-19 way before, just when there was a few cases in Asia. At the very beginning of March, even before the official pandemic started, they already started organizing work from home conditions for all employees over the 55 years old, for those employees who has more than 3 kids in their families, and for those employees who actually expressed that they have some chronic medical conditions. So already at that point, they send them work from home, and especially if they had to use the public transport to and from work, so they are not getting exposed, they don't risk their health. And at the later stage, when the pandemic was escalating, they already have 70% of employees working from home. And also they introduced what is called, they were very worried because this working from home and all this situation is very stressful for the employees and for their families. So they wanted to make sure that the company, that they are aware that the company is thinking about them and will take care about them. So for those reasons, they have organized medical assistant and testing service. It's separate from the official governmental service. It's company medical assistant and testing service. And you know that sometimes you have to wait a few days or some results of the tests are uncertain. So if there was some symptoms, employee could call this service and the medical assistant would arrive and take extra testing and will help and assist to the families. So so basically all employees know that at any point they could call to this special line and the medical assistant will arrive. Don't need to wait until the other services will come.
Irina,
and of course,
Irina, sorry.
Yeah.
I think Elena is now, I can see Elena. I don't know if Elena can hear us or if she can join us now. That would be great. Elena, can you hear us? And
are you hearing me?
Yes, we do. We do.
Oh.
Yes, yes.
Thank you very much. Sorry for my face because this mask is 100% in all working place in working time. Could Irina continue her speech, and after that maybe I will participate to you.
Okay, perfect. Thank you. So Irina, back to you.
Well, yeah, I will just say a few more words. That is actually that helped very much to reduce stress for the employees and for their families as well. And so they're not only thinking about the employees, but also about the families. And they really know that the company cares. and they know where to call, and they are not going to be alone. If there is anything happened and they get sick, they will get an assistance, and they will get medical help. And of course, this service was not just organized, it was organized in connection with all the official governmental medical services. So they all, contact to each other. So that is basically what I was going to say. So back to Elena.
Yeah, thank you very much, Irina. Elena, would you like to add to what Irina has told us?
Thank you very much, and I'm sorry that we have technical points in my view and participation in conference. Yeah, we have very serious attention to this problem because, the people for us is famous question, if, as I can say. And our medical assistants plus government medical assistants, I think will have big, not big, sensitive point for our employees. Those knows that we are ready to help, we are very closely, and our CEO fully involving in this process. Look at me, it is mask. Look at me, it is gloves. Each day we are using this because we are worried about our colleagues. We are in Moscow. In Moscow situation is not just so difficult, etc., but we need to be sure that we protect our family because we need to assess the situation very the assessing need be very serious. And, we put this early morning when we will go to office. And I put out this only at home because I'm using taxi. I working with my colleague who contact to family and people in a supermarket, and etc., etc., etc. It is just, I show what we are living now.
Perfect. No, thank you very much. Thank you very much, Elena, and also for providing the proof that you actually have protective equipment, because it's the first of the colleagues that actually demonstrates that you have the gloves and you have the masks.
Thank you very much.
So, well, one of the questions that has been presented by our audience now, I think, is an important one to all of you, because you all have now identified vulnerable groups, individuals that kind of you protect by letting them work from home or not letting them work. But the question is, are they worried, or do they have to be worried about their jobs? Is there a risk that they will lose their jobs? And so that there is a kind of discrimination that comes up because of age, because of preconditions, because of pregnancy. Could you just give an answer to this question, which was presented online, shortly? Maybe, I hope it's short, that you all confirm that this does not take place. But let's start with Jose Manuel.
Well, it's a straight answer is no, and this is the reason in the presentation I made reference in the approach. No, that approach needs to be the one that we want to help them, not to fire them. No. So it's important that you get the trust of your employees, and that in order to identify them, they need to give that, again, sensitive information. So that two things make the process a little bit difficult, no? Because it's something that, as you said, people is sometimes scared to share because they may think, okay, maybe they will use this information in the future to fire me before other person, no? But first of all, that's illegal, and second, that's not in the process of the company. Okay.
Thank you for a very clear answer. Philippe?
Yeah, that's also in the DNA. That's also in the DNA of the company. I mean, we have a very vast program that is called diversity, which takes into account every gender that we could think of. And in fact, there is absolutely no reason for being worrying about losing a job. I mean, there is also a side effect with working at home. Some HR had noticed that when you work at home, you work more, more than when you're working on site. So there is kind of benefit of keeping people working at home, especially if they don't have anything to do on site, because then they're sure that, in fact, people are really working hard, as they do every day, but even a little bit more, simply because you can save some time instead of driving your car, instead of spending some time in public transportation, you can spend a bit more time at home, and then that's better for everybody. I mean, I prefer to work at home rather than spending 2 hours behind the wheel driving my car and working gently here at home. I mean, I think that it's a win-win situation for everybody.
Perfect. Thank you. Thank you for this confirmation. And Elena did this already. There's a question from Sarah Vega. This just, I think I can answer it because she wonders what Zarubezhnev's business is. And Zarubezhnev is a Russian company with international activities in the field of oil and gas. So one of the big players in the Russian Federation. So I just wanted to add this because I forgot to present this a bit more in detail at the beginning. So this is also answered. And with this, time is up for this the second roundtable. Thank you very much. And especially I think now to Philippe is thank you and goodbye, because you have you have done your bit, and you know you're also busy with other activities. So thank you very much, Philippe, for sharing your and your company's excellent experiences. And same for Jose Manuel, I think. No, that
yes,
you also will have you have to leave, while Elena will come back, and then I will give you the floor as a first panelist, and we cross fingers that everything will work out fine. So thank you very much. And with this, I would like to present the third roundtable. And as you might know, globally, about 3 billion people have been or still are in confinement. And their safe return to work is our main concern during this third roundtable. Besides protection measures to avoid the spread of the virus and possible new infections, it has become evident that the negative mental health impact of the pandemic also must be addressed, which already has been touched by some of our speakers today. But how do we as prevention experts provide these services, and are we ready to meet the increasingly individualized prevention demands? So with this, I would like to welcome our panel, Jesper Krag-Nielsen, who is Senior Project Manager in Health and Safety at Novo Nordisk, Elena Kompasenko of Zarubezhnev, and Franco Duto of Sabuki Nakashima, who has been with us before. So with this, I hand the floor over to Jesper to give us an introduction to this topic.
Thank you very much, Hans. And I also, like the previous, have a little presentation that I would like to share with you. Yes, as you said, I'm from Novo Nordisk in Denmark, a big pharmaceutical company providing insulin and other therapeutics for chronic diseases. I think it's important here to remember that, at least for us as health and safety professionals, that we have some guidelines or some leading stars in our Novo Nordisk way, as we call it, where we have 10 essentials on how to conduct our work in general. And our essential number 8 is that we have a healthy and engaging working environment, that we are trying to establish safe working conditions, and we would like to support our employees in making safe choices, as nobody should be at risk of getting ill or injured when working at Novo Nordisk. And then you can say how we do that when we suddenly are apart from each other, when we're no longer talking together in the hallways or other normal areas. First thing, we actually redid our whole web page We have a vast SharePoint website on the Novo Nordisk webpage internally, and it was completely redone in matter of, I think it was a matter of days or at least a week or two. It was completely redone because we could see all the questions were all concerning COVID-19 and how to deal with it. So we actually started writing down all these questions that we actually were getting and actually formalized them into actual advice that we could hand out through the web page. And it's actually one of the most visited web page on the whole intranet. Here again, a couple of, you can see the diversity of questions that have been heading into, even how to talk to your child about COVID-19. But it also now, I think also Franco Dutto has mentioned that this new situation also presents opportunities, but also dilemmas that we haven't seen before. And here are some of the dilemmas or some of the questions that we are now starting to ask ourselves in the health and safety professional area. So when we start to work at home, how do we define this new fine line between the private life and the work life when we're working at home? Can we tell people that they should have an elevation desk? Should we provide it to them? Do we talk about healthy food choices or smoking? And all of these other questions that we normally actually think that that's okay to talk about if we are in the office. But what about when we now are at home? We also now have discussed a little bit about these vulnerable groups and how we are dealing with them, providing them with a safe working environment. But does this actually entail some kind of inequality that we need to be aware of, and new signals here that we should start to learn to see when we can see inequality is starting to be prominent in our teams? And again, maybe it's where we can see that our health and safety are becoming more individualized. So my working conditions may be very different in my home from my colleague that was sitting in a different home with some other possibilities. So have we now health and safety processes in place that can actually cope with this individualization of our health and safety schemes? And this also goes back to the role of health and safety professionals. Yeah, are they changing? I think actually in some areas we have been policing and providing with rules and stuff like that. But now since we are not there, we are not at home, we need to be able to inspire more and enable more to make the right decisions. In other areas where we are not able to inspire and enable because that requires that we actually have the knowledge to make the right choices, we might actually need to start policing a little bit more than we have done before. For instance, in personal hygiene and stuff like that, that's been very sensitive to talk about that in some areas. But now it's actually okay to say that, did you remember to wash your hands? Have you cleaned your desk after this work day and stuff like that? So how do we handle all these new questions? How do we answer them? And how do we provide the right knowledge to our employees so that they can make the right choices, both for themselves, for their families, but also for their colleagues? Yes, so these are for me the 5 questions or the 4 questions I would like for us to discuss in this roundtable, and also concludes my presentation.
Thank you very much, Jesper, for sharing these views, and in particular, I think also some very interesting questions that we haven't actually addressed yet. What does it mean for prevention people, no? For the prevention services in businesses, that these changes are taking place? And we have traditionally a very collective approach to things and not an individualized approach to things. And,
yes, and if I may add, actually the Danish occupational health and safety law actually says that it's the employer's obligation and responsibility to provide a health and safety working environment. But how is that possible for an employer when the employees are at home?
Yeah, no, I think these are good questions. So let's hear what Elena has to tell us, or can tell us about how you at Zarubezhnev work with all risks now, not just the infection risk, but also other risks. And maybe you also have considered some of the topics that Jesper has spoken about. But please tell us a bit about how you at Zarubezhnev are approaching, let's say, the global risks related to the pandemic.
Thank you very much. And the second topic to address today, I'm going to talk about how we are raising this health risk related to the COVID-19 in our facilities. First of all, more than 70% of employees right now are working for the remote location. And for those who need to go to office, we have provided masks, gloves, CDs, and antiseptics at the workplace, and to go to or from work. It's like, you know, we must have. We also have organized the workplace to keep the social distance, only one person per room, per office, set time to go to the canteen, food at the time, containers, and etc. But for us, was a challenge to organize a workplace for those who works at the fields. The decisions were taken to close all our fields, isolate them from new people coming to site. Of course, it caused a lot of challenge. We talked to employees, and all of them agreed to stay at the field for 55 or 60 days without rotation. And now at today, we have more than this time, because, you know, that process, in this process, we involved contractors, sorry. Yep. I have to say that during this pandemic time, we saw sorry, a lot of commitment from employees and management to do everything to make sure we do not allow the situation to escalate. As for the measures, of course, we have provided masks, gloves, and antiseptic, as I said before, antiseptics to everyone. We have representative 12 hours shift take hour between crew without personal contact. All personnel is measured to favor of or other symptoms before every shift. We have medical services on standby, and if there is any records of the symptoms, they isolate persons and discontacts and do the test. There were no canteen opened. All food was delivered directly to the workplace in dispensable containers, and we keep people in the living quarters separate. Have say all these mentions help us to keep workplace clean. So recently we have decided to rotate our crews, but had to do it step by step to make sure we are avoid risk to operations shut down. Crew change was adjusted in such a way, and every group coming to the location had a full seat of specialists to make sure the condition operation could go on. Drilling engineer, production engineer, supports, HEC, etc. They were also located in living quarters close by, and in case of everyone developing symptoms, who block was isolated and put under close medicine. We are monitoring, and but science other team had also a full set of specialist operations will go on. So far we have completed the crew change, and it was very successful. I think it is. And have to say that all this measures help us to control pandemic. And you know, now all our people who are working in the field is sure that we are very close, because, you know, for this day, for 19th of May, we have no COVID in our facilities. It's true. Thank you very much.
Thank you, and congratulations. Now, as you said,
thank you very much.
You took your measures very early,
and like we do it,
and very consistent. So now I hope in the discussion we will maybe also touch a bit upon what is implicit in what you said, because you said something about you had to ask people and they agreed to stay longer in these.
Absolutely, yeah.
And we all know
only after agreement.
Yeah. But we know that these are harsh conditions, no? And that this also has some psychological impact. You're remote from your family. There's the uncertainty now with the COVID crisis also emerging in the Russian Federation. You know, all these issues that can affect people. So the mental health issue, I think, is something that is, besides the more direct infection risk, is something we have to take very serious. But let me now go to Franco, because when I first heard Jesper and saw his questions, I immediately thought about you, because these are many of the questions that Jesper raises are very close to the HR field. Because as I said before, in occupational safety and health, you have the kind of tradition of looking into collective measures as they are established in the regulation, in the law. And while in HR, you take a much more personal approach, individual approach, because this is what you do in developing individuals at work. And this situation right now, as Jesper also brings up his questions, in a way, is very close to what your concerns, your day-to-day concerns also imply. So I wondered how do you see these questions raised by Jesper to the very function or functionality or concepts of prevention under these changing conditions of more individualized safety and health experiences and situations?
Yes, Jesper mentioned four very difficult questions, asked very difficult questions. I believe that I always start from the definition of HR, because HR is human resources. So, and sometimes we forget that we are talking about resources. The resources are very important because we spent a lot of time and money in the companies to take care of the raw materials, the machines, the processes, the continuous improvement, etc., etc. Sometimes we forget the people. So maybe COVID-19 is waking us up a little bit to really redefine the relationship between the company, the managers, and the people. Because I believe that the COVID-19 is teaching us that we are all vulnerable. And it's very interesting also referring to the previous presentation, the previous panel, that how different is the definition of the vulnerable employees between the labor, the HR, and the ES&H. And it's very connected there is a big connection between the salary, so the working conditions, the economical condition of the workers, and the physical condition at work. The second thing that I believe that it's very important to say is that you said, Jasper, ESH managers should be much more individualized, you know, instead of collective. I believe so, because now H&S is more H than S. So yesterday was much more safety. Now is much more health. And we have to start to have a really very high level of individual approaches. Also because, you know, managing the work at home and putting together the different experiences, working at home and working in the workplace, I mean, it's not easy. It's not easy to accept the people back, you know, create the right relationship, the right work environment to deal with the people. I believe that there is also another really big correlation between, because unfortunately, now we are all understanding, the people, our people are understanding that there is a direct correlation between the life and the work, the life and the health risks, and the work and the health risks, because we are not living 3 lives. We are living only 1 life that is divided maybe in 3, no? The working life, the private life, and sleeping. I believe that also what it will be very, very important is to work a lot on the well-being, because the well-being is really the way to prevent the risks at the workplace and at home. It's a paradox maybe, but also I believe that the people, mentioning Philippe, what was said, Philippe said before, that the people are working much more, but they are seated much more. So potentially we have the risk to have the people back at work in worse physical condition than before. So we have to work also that. And I believe that the ESH manager should really have to redefine his or her role in order to be much more aligned with the situation that now is evident.
Well, thank you very much. Thank you very much indeed. There is a question I think which is quite relevant, because I don't know from whom, but the question is good, and it's regarding the lockdown and home office. So everybody, I think, has been talking about that one of the mitigation measures is to ask people to stay home and work from home. And Jesper mentioned, but under which conditions? No, from one day to the other. No, you asked to stay home, and this is government policy, this is business policy, no, company policy, and you're asked to work from home. So the company facilitates, you have seen miraculously during a weekend, you establish thousands of new internet connections, and people actually can work from home, and that's it. So how this whole process, of course, we all understand right now, we are still under this crisis, and we do crisis management. We are all very motivated. Now, so this is what we heard also. Staff work much more. They take initiatives. They're loyal to the company. They also may be a bit concerned about their jobs. So they're under the pressure of the situation. But this cannot be a constant, no? Because this would be against our principles of prevention. So what I would be interested in is, as I have heard through many of the presentations that we have had over these webinars, that you expect that there will be more flexible workplace arrangements, and maybe also work time arrangements in the future, that also after the COVID crisis, we will work to a higher degree from home. They might use more digital channels to have meetings and so on and so forth. So restricting or reducing our kind of carbon footprint and traveling and all of that. But but have you prepared plans for that? Is this in the pipeline, or do you still are in the crisis mode and firefighting, or is there already a master plan for the new reality, or the new normal, as many call it? So that's an open question to the three of you. So who would like to start? Jesper, yeah, you were the start. So
maybe I could start by saying that as I tried to present is that we are trying actually to establish this knowledge that people need in order to make these right choices back at home. But there are also some uncertainties that we need to look into. And so, of course, we have a strategy on how can we actually utilize this new flexibility that has been created with this fast track digitalization that we are into. That it's actually possible to have enough, as you said, internet connection to make this webinar or meetings and stuff like that. So now we actually have the infrastructure in order to actually work from home. So how do we use that flexibility to our advantage in the future? Then there are some uncertainties, and you also said it with the psychosocial mental well-being. How is that affected by this staying at home? I think at some point in the news they said that the alcohol consumption, or at least the sales in alcohol, increased dramatically during these shutdowns in Denmark. I don't know if it's because we are drinking the beer home instead of going to a restaurant, or if it's actually a warning sign that we are actually seeing some mental aspects that have been hidden before. So I think one of the things we are looking into is if we can make strategic partnerships with especially the research side of things, see if we can start learning more on these effects. How does this affect people? Not only physically, because I agree with Franco Dutto that we need to have the same economic, we need to have the same power breaks, or whatever we call it, physical breaks during the day as we used to in the office. But there are also some uncertainties in the long run on how we are affected by working at home. We see how people react strongly when they communicate on social media, and not always for the better, sometimes actually for the worse. And does this dehumanization of colleagues mean something on the way we talk and speak to each other that we also need to be aware of? That's not, we haven't seen that at all yet. But what if, as you say, this becomes a more permanent situation? Will we then see some of these things?
Thank you very much, Jesper. Let me ask Elena. Elena?
Yes.
This is really, I have the same mask, by the way. Made in China, I think. But no, but
I see me.
So
you see me. You see me.
The question also for you, now that you said you have 70% of people working from home, have you made provisions for their working conditions at home, or is this really seen as a strict temporary measure, a short-term measure?
Oh, yes, of course. We prepare the condition for the effective work. Each of them have a computer, and we have motivation program. And, you know, each of our employees have 100% salary, you know, and we provide some like, you know, social assessment. We think about kids, because sometimes we have, you know, like a competition. We have a program, for example, in Russian, it is like the best idea. Who of our employees have a proposal to make something that those work at home was more effective.
Very good.
You know, as well, each of them said us, could we go to the office? Because, you know, at home it's very difficult because family is at home and you need to work. And work is not so easy because family is very close. But before we did them, we prepared a program for the people who will go to homework.
Thank you very much. Thank you, Elena. So
Thank
Franco,
you.
very briefly, because we are a bit over time, but the question, the same question, have you a company policy towards home working? Have this developed as a more looking into the future, a feature that you see permanent?
Yes, let me say that personally, I don't believe that working from home is the future or the solution for every evil. It's a tool. I mean, it is giving flexibility to the people and then to the company, but the people are much more important. Second, because we are social animals. So we are, one of the things that we are learning now is how important is the value to stay together. So we cannot imagine a world that where everyone is working alone at home or on an island like Philippe before. You know, living a difficult moment like that is teaching us the fact that we are much more one team, the one team spirit. So, and this is something that this is what we are doing. We are stopping a little bit the emergency and thinking the good and the bad of this event at this moment in time, in order to maximize the strengths and minimize the weaknesses in the future. This is the only thing that we can do.
Perfect. Well, thank you very much indeed. We say goodbye now to Elena, who fortunately made it. So good that that the internet worked and the condition worked, and and we were very pleased about this possibility that you could share with us your experiences. Franco, as always, it's a pleasure. Thank you so much also for your wisdom and your thoughts. And with this, Jesper will stay for the next, the final round. It's my pleasure to introduce the last roundtable. And this is an interesting one because it's about behavior. No, I think we've been talking about this now in the last half hour also. It's about social distancing. It's about use of PPEs. It's about this strict personal hygiene, which we know are critical to avoid the virus infection. So the fourth roundtable asks, how can we actually promote a safer and healthier behavior at work? And besides the purely physical design of that, how can we promote personal engagement and social control to support such behavior? So please welcome together with me our panel, Gianluca Capodimonte, who is an EHS manager at Philip Morris, his colleague also from Philip Morris, Stephanie Thierry, who is a head of sustainable global manufacturing, and Jesper Carl-Nielsen of Novo Nordisk, who you already have met. So it will be Gianluca. Are you growing a beard or what?
Yes, and this is a style. Also the hair now. Yesterday the hairdresser reopened, but there is a long list before getting access.
But maybe you are a sailor by heart. You know, sailors do that. When they start their sailing, they start growing the beard.
Yes, we are in the storm now, so you have to do something as a good sailor man. Yes.
So please, Gianluca, the floor is yours.
Yes, thank you. I'm sharing my screen because I prepared a few slides just to guide the discussion and to show a few things that we did. So there are many, so you had to select something that is the most representative for us. So you see on the left, there is the solution. What you find on the right are the mitigations that we are putting now in place. So we need to pay attention to social distancing, PPE usage, keep attention high because the virus is still with us. This didn't disappear. So this will happen when the solution on the left will be available for everyone. So the communication is fundamental. To shape the behaviors, I think that the communication has to come from different sources. So we have been bombarded from different angles with the same strong messages, how social distancing is fundamental to survive in these difficult times. How wearing the PPE is key. How to take care of each other is the winning factor against this virus outbreak. Then there is something that I heard already from my colleagues in this call, that well-being and mental health. So I really like the comment that say now we are much more H than S, because in the past the S was very big, the H much smaller compared to the S, mainly because the impact is long term. We don't see immediately the cause effect. With this virus, we had found something in between. So it's about health. The impact is quite fast, is coming soon. The potential risk is very high because we saw how many fatalities we had. Doesn't matter at a certain point with this your risk profile. We saw that above 30 years old, there was not big differentiation. Of course, elderly people were the most impacted. So going back to the behaviors, what we have to shape is changing totally the way we are interacting with our colleagues. So keeping the distance. Before Franco was saying we are social animals. And I think that this society in the factory is fundamental also to achieve results. So how we can keep the team united, respecting the rules, and also respecting the others, because it's not anymore a matter of respecting the rules. It's respecting the others, the key message. So if you're able to keep this distance. So the communication should be focusing on the respect. The rules are just a tool to ensure that everybody can go back home. So here you will see some picture, and then Stephanie will complement with some technical details on things that we have done, mainly in operations. The factory is a big community that the key success factor is really working together. Here we started to isolate people. We were putting barriers left and right. What you see here on the table is already different because we are changing the layout following the guidelines that we are receiving from the authorities, the best practices that we are sharing in our factory. And all this information that you see is communicated, is sustained through different tools. There is an important role of the leadership because we need to be consistent in the messages that we are giving. And of course, there is also an individual responsibility. Each one is taking care of the others. So familiarize with the mask, that for sure in the Western culture is not really something that we used to do when we were sick. Maybe in Asia, that was a bit easier because it's part of the culture to protect the others using and wearing masks. Again, on a shop floor, on a production floor, the distances sometimes become very, very close, and we need to protect our people applying the tools. So new rules about hand sanitation, the way we are protecting ourselves and the others when we are in the workplace. One of the main comments that we heard these days, because we were in different forum, different discussion in Philip Morris recently in the European Work Council meeting, people feel safer at work much more than in other places. Even if the lockdown now is opening up, most of the people believe that a well-organized factory is still a good place to be in these COVID times. So Stephanie will tell you more about smart ideas that we had. For us, in our standard work practices, we had several tools that we decided simply to adapt to the new situation. So observing each other, having a behavioral observation with a really very natural and felt feeling of taking care of the other. So we were simply adapting our behavioral observation system. We had also other tools that are part of our daily routines that we have in the production floor, like a checklist before starting the shift. Similarly, we did the same. We were including discussion points about COVID, ensuring that people with flu-like symptoms are declaring this factor. This was also a very, very important element because I guess in other companies, there was an incentive, a reward for those that unfortunately they had to go to work because they are working in essential services. And For them, maybe additional money could be tricky because it was a trade-off that they had to manage. So it means, do I tell that I have some symptoms and I will lose this opportunity to get extra money, or I jeopardize the safety of my colleagues? So again, communication here has been key. Honest approach to situations where people had flu-like symptoms is key. And the continuous reminding of the correct practices is fundamental. So a surprise was in the, let's say, health and well-being part. It's impressive. I couldn't list all of them. Here is just a small percentage of the initiatives that have been taken, proposed, and done by our colleagues all across the world. So how much offering help to the others outside the factory, in the communities where we are working, help the, let's say, people to stay alive, to stay engaged, to find a purpose in this phase where everything was really looking extremely different from the normal life. And this is a big learning. We were struggling to say how we can ensure mental health. Of course, we need to do much more things, considering people working from home. But I think giving opportunity people to do activities, to serve, to help the others has been really a big relief for many people that at a certain point were feeling lost in this situation. So I think this was giving a purpose to their life, big satisfaction, because I think that personally, when you can help somebody, you're happy. This is something that really represents, at least for me, the real happiness. And those activities were proliferating in each factory, in each office that we have across the world. And one of the most interesting things is how proud people were to share what they did. Normally, I think that in most of these large companies, you have social networking inside the organization. And it's always a bit lazy. It's difficult to motivate people to post initiatives, activities, things that they're doing. Yet it's unbelievable how many posts, how many comments we received. And this big, let's say, group of team people that were helping in different sectors, taking care of elderly people, preparing meals for less fortunate people, helping out with the other organizations or working in special projects. We were delivering hand sanitizers to a lot of organizations, or try to convert our machines to produce masks or other things. So this generated a huge quantity of energy. I think that there is something remarkable that happened in April. So when we look into the performance of the PMI in terms of operations, we were breaking records on records in terms of productivity, quality. So I had the feeling that people with the right motivation, with the right guidance, have released all their energy into the work somehow. I understand that this is not sustainable in the long term, because you need to have a right balance between your private and professional life. But I think that they felt really appreciated for what they're doing, for the effort, and they were really producing and supporting the company with the extra motivation, extra energy. So this was very interesting, because we didn't expect a so strong answer from the people in these difficult times, when they had to adapt a lot of new behaviors to the situation. So was something that made a big reflection. So the smart way to change behavior, to change also the approach to the life in this difficult period, for sure was much more related to the part of offering help where needed. So, and the company supporting this, this initiative. So this is just a quick introduction to say the behavioral science is a very complex domain. So the human being, I think, is one of the most complex machines. First of all, because each one is different from the other. So it's difficult to identify a common approach. On the other end, we saw that with really culture of prevention, taking care of the people, keeping the communication open and transparent, deploying simple things, adapting existing things, simplifying as much as possible. We create the space to add additional, to create additional, let's say, place for new things that were totally unplanned. They came out of the blue and we had to adapt fast.
Thank you very much, Gianluca, for this inspiring introduction and yeah, impressive experiences about human nature, and which is quite comforting during these stressful days. That one thing that keeps us together is our willingness to help each other. And that's a strong human element in what we do. So thank you for that. I know now that Stephanie wants to dig a bit deeper into what you're doing and explaining a bit more how you're trying to actively engage your staff in taking care of their and their colleagues' safety, health, and well-being. So please, Stephanie, you have the floor.
Thank you very much. Yeah, what I would like to highlight and building on to what Gianluca has exposed. He was mentioning that in this period of COVID, we have broken many records. And part of this record is safety. We could have expected maybe to have some more accidents, people under stress, or whatever situation that are putting people in a position to take some risk or have a lower attention. But finally, we discovered that in this period of COVID, we have drastically improved. And okay, the analysis and talking also with people inside of the company and getting feedback, we realized that the behavioral observation is really playing a lot in the story. And this is what I would like to share with you today, what we do in terms of behavioral observation. That is not something new in the concept, but maybe the way of practicing these observations is something worth to share with this audience, and at least that we would like to bring a bit of experience and feedback about how we manage this in our company. So the principle of behavioral observation is the fundamental element. The way we manage this is really the care to each other. And Gianluca was mentioning this care approach several times in this introduction. This is something that is really making the core of the approach to observe each other. So it's from far not a top-down observation, but it's just taking a moment of care to each other. Exactly as we would do if we see, I often use this example. If you see a child in the street crossing the street, you are not telling that you are not the mother of or the father looking at the risk with the car arriving on the child or whatever. It's just taking a moment of genuine attention, human attention to the others. And this is something that we have really fostered to calm down a little bit this fear of the watch of the policeman. That is absolutely not the purpose. So taking care to each other, and also through the conversation when we observe someone, is first to raise the positive and not highlighting not the negative but the unwanted behavior, because we tend not to talk about negative, because when we have unwanted behaviors, it is most of the time triggered by just some elements that are putting the person in a situation to take the wrong choice. And it's not by design to make the things wrong, because people are simply willing to make something wrong, but it's also to understand through the conversation what are these behavioral activators that make a person in a situation to take the wrong way. Is it something that is just the person is under stress, or is suffering any personal issue or issue with the family, whatever? When we arrive at work, we have also this background sometimes. Also sometimes just because the environment is not the proper one, or the training is just a piece of paper on the wall and finally is not understood the reason why I should behave in that direction. So all these elements that are triggering unwanted behaviors is something that we drive more and more into the discussion with the person to understand first, okay, the situation and how, as an observer, and because it's not a one way, okay, it's not a top-down discussion, It's really a conversation. How can I, observing a situation, help the person to bring the proper, let's say, environment so that the person can behave the next time, let's say, spontaneously in a way that is the one that is expected. And also through this behavioral observation, as I was starting with, is before focusing on the elements that are unwanted, is really to magnify the ones that are expected. Because the people are role modeling, and sometimes we tend to forget the effort that could be behind. Just take a 5S, for example, and being also a mother and fighting every day with how my children are putting the things at the right place, etc. Managing a 5S is a challenge in itself, I mean, and we often tend to just forget that there is an effort behind. So just magnifying what is good and engaging people to really reinforce this role model and inspire others, train others doing the right things. Second part is on these behavioral observations. Also, what we have tried to do is to focus on 3 elements only, where we want to have people directing their attention. Based on the place where you are in the site, could be an office, could be a production area, could be the utilities, you have different risks. And based on your risk assessment and based also on the frequency of near misses that you could have, you are going to decide to focus the attention of the observers during a month, during a longer period of time, but not forever, on 3 elements that you believe are the important one. And when I say when you believe, I want to correct a little bit also this part. It's not as an EHS professional that you design what you are going to focus the audience to run the observations, but find an agreement within the team, within the users of the place, what is recognized as being the most critical risk, and on what do you agree as a team to get observed to each other about this risk. And once it becomes relevant for everyone, that these are the risks to focus on during a certain period of time, the people have also this kind of legitimacy. I don't know if it's an English word. The relevance, okay, and feel at ease to observe the others because it was agreed upfront to have observations around that. So it's not felt like a top-down approach and I arrive and I tell you that it's not the right thing, but the agreement to observe and focus on something. 3 elements only during a period of time, and then there is still an open space. Obviously, if you see something that is separate from these 3 elements, you can still raise also the point on any situation that you want to raise. And based on the statistics, also, if you see something that is coming again and again, and that is not part of these 3 main elements, you can also agree to insert this point of attention during a period of time. So this is the process of the observations that we do. And maybe one point also that is maybe a bit different than the approach of observation that I have observed in different companies is that the first point of focus is the engagement. What we have really focused on is not the number of observations and not having a lot of observations done by a restricted number of people that are much more firefighting and distributing bad or good points all along the time. It's really to have the entire organization, everybody up to contracted people, so it's not only employees, but contracted people, to have received the training in the way I have described to you and practice this at least once per month. It's not that a big deal, but everybody is doing it. And it is a common sense that giving some time of attention to each other, 1 time in the month is manageable. And yeah, everybody should be able to do it. And now to close the loop with the COVID based on these three main risks. We have adapted the tool during this specific period of time to have one point of attention on these practices of social distancing, wearing the PPEs to this tool. And this is, the story I wanted to share with you today.
Well, thank you very much, Stephanie and Gianluca, to share these experiences from Philip Morris International. Very interesting, and I know that Jesper finds it also interesting because in Novo Nordisk, at Novo Nordisk, I had the pleasure to be there and to discuss these issues. You also have engaged in trying to involve all the employees in a process now of being conscious about risk, taking care of each other, and so on. So I look forward to your comments, to what you have heard, and to our agenda of smart ways to promote safe and healthy behavior. Your colleague, also member of our council, Tina, has shared with us once a presentation about behavioral design and how this is working in your company. So I wanted to hear from your perspective as well. So please share with us your experiences.
Thank you very much. Basically, you can say that we are very much in line here with Philip Morris, and I think we have generally the exact same approach. Maybe we will not call it observations, but we typically call it a process confirmation, and use that as a part of our lean journey, lean manufacturing journey. And we also use, as you mentioned, this behavioral design concept in making nudging and basically a lot of the same things that we have seen from Gianluca, which is very, very good. Again, I would like to try to pull myself up a little bit again in the helicopter and try to also view it more holistically, because I think we are actually very good and very well trained in this safety and health, physical health environment. And I see that I could wish that we all, myself included, is starting to use some of this creativity that we've seen within the physical health transferred into the psychosocial health and mental well-being as well. Because I see that it's very much difficult to make the same kind of observations. And I think we have maybe some blind sides here, especially during the lockdown. How do we observe that my colleague is showing signs of stress? How do I talk to my colleague about his or her situation at home? And that's much more difficult when we're not in meeting and when we're not seeing the body signs or all the other signals that we usually use. Also, like Franco said, that we are social animals, and we are used to picking up these small signals. That may be very difficult if we all just talk to each other on audio. So one of the things that we are actually trying to do in my own team is that when we're doing a Teams meeting that we do every day, we meet up in a Teams meeting with video. So we are enabled actually to see each other, and it has a huge impact on how we talk to each other. And also having once a week, we do mental well-being, kind of a small survey where we're just talking about how was your week and how do you see your coming week in terms of work-life balance and the activities that we have planned. So we try to verbalize it just as we would have in the office, but perhaps in a more formal way and a more strict way, because we need to address it more directly, because we don't have these small signals to act upon. And I hope that we can also, when we go forward, depending on, and I totally also agree with Franco, who mentioned that working from home is not a permanent or complete solution and answer to everything, because creative work is done together in the same room. Maybe looking at some data and making some charts or making a presentation is something that's best done home. So of course I think we're going to see a more activity-based work life where we are doing the most sensible thing for this activity that I'm doing. But then how do I do these observations that are so vital for us all in order to pick up these small signals of not feeling well, either physically or mentally?
Thank you very much, Jesper. I'm sure that Gianluca or Stephanie would like to react to that, because I think it was a very good comment, and also raising the issue of what are the limitations now of working in the way we do also right now with each other now, and how do we observe the unobservable when we do it virtually? I don't know, Stephanie, I take it you have a reaction to that.
No, I tend to have a different view on this. Okay, just talking about the experience of the team close to me, and yeah, they are reporting that they would love to continue being able to work from home. They have children at home. They can better balance their life. One of my team members has approximately 2.5 hours per day in a car to go in an office where she's doing exactly the same from home. And she's telling me, I have more time for my work, more time for my private life, and I feel better in this COVID time. And I would not like to go back to the normal. We had a very nice experience 2 days ago with Gianluca, having activities that normally there was this assumption that we should be all there in the opposite of the world, having several team members flying there to be all in the same room during 2 days to run some workshop. And finally, we did it remotely, and it was a huge experience. I mean, so not to say that we need to work completely remotely, but the back to normal definitely, I think, will be a back to new normal, I believe. And at least allowing this flexibility, to me, is really value added. And I think that a bit forced through the COVID experience, we have been in position to experiment new ways of working that I think will affect positively the future.
Yeah, thank you very much. And thank you for reminding me of my old days in the Geneva Lake area, because their commuting is part of everyday life. I don't know anybody who has less than an hour commuting time each way. It's really awful. It's true. And the motorways are not capable of managing it, and so on. Every day there are queues, and now I had staff coming from Annecy and from other places. Now it's to Geneva. It's true. It shows it's a multifaceted issue, but what I found important is that there are certain issues you can do, and this discussion that we go from safety to health, and maybe even to well-being now with the COVID and with these issues we are discussing, and how can we actually grab the elements related to well-being through observations, through our channels in this new normal, or at least this changed normal that we will experience. And I think that's an interesting question for us for the future. And I have taken note of it, because we have to close, I think, the session now also for our audience, because we are behind schedule. So just to say, I've taken note of it, and I think that could be a very good topic to address in the Business Council, to go more into depth into these issues and many of the other 3 topics that we have discussed today. This is all work in progress now. We're still learning and things are developing. But what I really liked about this session, and also the other sessions, is that we are coping with the situation. There are some challenges, but there are also some opportunities, and it's about grabbing these opportunities. And that I heard a lot about, and that what you are doing, I really would like to congratulate you and the other speakers and panelists today for sharing exactly this approach, looking for the opportunities in improving safety, health, and well-being at work under these very strange conditions that we have at work and at home now. And I think it confirms me in my belief that this is a unique opportunity for us to really focus on prevention culture, on focusing on what we have in common and what we are good at as humans, and at work and at home, and that we can do much more and much better if we do it together and do it through networking, and also the networks that the ORP Foundation and that the Business Council offers. So thank you for that. And with this, I would like to close our last webinar. Thank the audience for their patience, and because also today we had almost 500 registered participants, and we know there are lots of views of the YouTube video that also issue afterwards. So I think it has been worthwhile, and I think it has been even motivating to continue certain of these activities also in the future. As you also discussed, I think it's also for us easier sometimes to meet in this way than to try to fix a meeting date, a physical meeting date somewhere in the world. So this is also a lesson learned for us. And I would like to thank, as I said, all the speakers for sharing during this and the earlier webinars. The audience that was very patient and very interactive. So we had a lot of comments. I've shared just a few of the questions that came up. And I also would like to thank the OP Foundation for facilitating the logistics, in particular Natalia Mendes, who has been the wizard behind the screen, so to say, and has made all of this possible. So also to Pablo, to Pedro, and all that have been so kind to facilitate this collaboration. I think this will not be the last one. So with this, thank you once again, and good luck, and stay safe.
Thank you.
Thank you.
Thank you.
Bye.
Thank you. Bye-bye.
Bye.